Hi, I'm Jennifer Taylor. I'm going to be doing an informative speech today on sacroiliac joint dysfunction. This is a medical condition that many people suffer from. However, it's somewhat rare. Most people don't know about it. It's a condition that I actually have. It's a chronic situation that I'm going to have the rest of my life, and I was diagnosed with it back in 2010, so I've been dealing with it for 6 years now. I actually started the pain in 2001, so I was dealing with it for 10 years before I was diagnosed, but now I know what it is and we can work on getting me some relief. So what it is if you look at this document, this is a picture of your sacrum and your ilium, and your sacroiliac joint is this joint right here where your sacrum and your ilium come together, and sacroiliac joint dysfunction is the inflammation of that joint. It's very painful, and it causes pain in many areas of your body. If you look at this document, it's a picture of your low back, legs, and then your front area. It's from your waist down, basically. So here's the most prolific pain area from the sacroiliac joint. It's um, this is where your ilium and your sacrum come together, and so that's the most prolific area of pain. Your pain shoots down the buttocks and the side of the leg, and you also have quite a bit amount of pain right here in your lower buttocks, and then in the side of your hip you have something called a trochanteric bursa, and that gets inflamed and it causes trochanteric bursitis, so that they can give you an injection in your bursa to help with that. You also have pain here where your iliac crest is, which are the top of your ilium bones, and you have a large amount of pain in your groin area shooting down the inside of your leg, and you have a lot of pain on the outer side of your leg where your sciatic nerve comes through here. So as you can tell, those are many different areas that this would cause pain, and this, can take over your life pretty much. It causes pain while you're sitting, when you're driving, if you're traveling in an airplane or on a bus or a train or whatever, anywhere you have to sit for a long amount of time, like work or, when you're traveling day to day. Also, it hurts a lot when you have to walk. So if you're going to the grocery store, even doing things like going to the state fair with your kids, you may need to use a cane to help you, or in a situation like when you're going to the state fair or traveling where you have to do a lot of walking, you may need to have a wheelchair. I actually have both of them. They help me a lot in my day-to-day life. I also use the electronic wheelchairs at the grocery stores to help me with the grocery shopping as well. Um, Sorry about that. My light keeps turning off in my car, but this is the quietest place to have this discussion, so I'm sorry about that. There are many different effective treatments that you can do. One treatment is physical therapy. You can do massage treatment. You can do adjustments from a chiropractor. You can do acupuncture. They can treat it with anti-inflammatories and pain medication. There are different, variations of pain medication or anti-inflammatories. Sometimes anti-inflammatories cause people to have ulcers or stomach problems, but they have other anti-inflammatories that will help with that as well. That's what they had to do for me, and I found quite an effective treatment with that. They will give you muscle relaxers for your buttock muscles and the side of your legs, because all of those things cause a great amount of pain. So they'll give you all of these items in conjunction with each other. You'll have to work through all of this stuff and find out what works best for you. There are other treatments that are they're higher level of treatment, but they're more conservative than a surgery, and they are a surgical procedure in that you have to have an injection of steroid into the joint, but they are longer lasting and more effective than, say, a chiropractic adjustment. So though they have a treatment called a nerve block. Well, they will inject steroid directly into that joint, and it will coat the nerves of that joint, and it will also coat the joint, and that will cause some pain. It can last up to 6